At this health centre in Birkenhead, people can walk in and be vaccinated. Some are only now getting their first jab, others getting round to their second, and there are over 50s taking up the booster, motivated by a sharp rise in infections and deaths.
I am concerned because I lost my son-in-law last Sunday because he didn't have the vaccines, and the life support was turned off last Sunday. So it's important that everybody gets the first, second and mainly the booster.
I did have an appointment in November, but when I found you could come in as a walk-in patient, I thought sooner the better, get it done.
But it seems many aren't in any rush to get their booster. Of double vaccinated over 80s in England, only half have had the third jab, prompting the Health Secretary to encourage those eligible to get the full set.
Winter provides perfect conditions for flu and COVID-19 to thrive. By getting your flu and booster jabs, you're not just protecting yourself, but you're protecting your loved ones and the NHS too.
The Westminster government says vaccinations and boosters will control the virus in England without the need to go to Plan B, a return to compulsory face masks and asking people to work from home. But some local public health chiefs have broken ranks and implemented their own Plan B measures. The Liverpool Health Protection Board has issued new advice urging people to wear masks on public transport and work from home. In Swindon, the council's appealing to people to start wearing masks in public again, with the COVID infection rate the highest it's ever been and hospital admissions rising 38% in a week. Today, more than 8,000 people are in hospital with COVID in the UK, roughly where we were this time last year. But at last winter's peak, more than 39,000 COVID patients needed beds. The scientific advisory group SAGE thinks another peak like that is unlikely, predicting instead a series of smaller spikes. Ministers say they keep Plan B restrictions in reserve if needed. But one senior public health figure has told this programme the government's been looking at what he called a Plan A+, which could involve a new position on face masks. The government denies any Plan A+, but does warn the coming months will be challenging.
Jane Deeth reporting. Well, earlier I spoke to Professor Peter Openshaw, who's a member of the government body NERVTAG, a subgroup of SAGE, which advises on the threats from respiratory viruses. I began by asking him whether he thought the government needs to act now.
If you look at the figures, we in the UK are not doing well by comparison with other Western European countries. You know, the infection rates are something like 7 times higher, and the hospital admissions about 6 times higher. The death rate is only maybe 3 times higher, but I think to me that's unacceptable. There's an unacceptable number of people still dying of COVID, and we need more time for the vaccines to catch up. We need to make more space.
And why are we doing so badly by comparison?
We're not wearing masks. I think that's a big problem. You know, not wearing masks on public transport. We're going into large public gatherings with very little precaution, where, you know, I think there's a big resistance in this country to carrying any sort of vaccine passport, which has gone down very easily in many other countries, where understandably wanting to get back to normal. But that does mean that we're carrying a very, very high rate of infection at the moment. And I think some of the people who are our leaders are not convinced that there's any way to really get everyone immune without letting the virus run through the community and generating so-called natural immunity. But I think that's a myth.
Are we also the victims of both the early timing of our vaccination program and a degree of complacency, as in haven't we done well to vaccinate so many people so quickly?
I think that's right. I think these things tend to go in an oscillation. If a very high rate of infection happens, then people really get worried about it and start doing all sorts of things which stop the infection from being transmitted. If we think we're doing really well, we become complacent and we take the foot off the brake.
And in terms of dealing with the fact that we got so many people vaccinated quite early on in the year, we just have to, you know, we have to step on the gas when it comes to the booster program, surely.
We absolutely do. And I think the government does know this. And there are many in government who are being very sensible and going public with with very strong statements about the importance of getting booster vaccines out. When we started, we didn't know how long the immunity induced by vaccination was going to last, but now I think it's clear that after 5 or 6 months, the protection is starting to wane very significantly, and we do need to bring in booster doses in order to put the protection right back up there in the sort of 90% range, which is where we want it to be now.
And yet the message coming from the upper echelons of government isn't one of alarm and caution. The messaging is very relaxed, even at the moment, isn't it?
Yes, I think it's partly a matter of getting the right information to the right people. I mean, I've heard an MP say that you can't get infected from somebody who's a close friend. Now, that's clearly wrong. You're most likely actually to get infected by somebody who possibly a member of your household. And there is no association between being friendly with somebody and having a low risk of catching COVID from them.
Okay, now that we've got that sorted out, how many weeks do we have left, or even days, before, to take measures before this becomes really serious later in the year?
In my view, it's already very serious indeed. We've got approximately 1 in 60 to 1 in 70 people infected. That's about 1 million people infected currently. And that is quite out of proportion with what's being seen in other Western European countries. We need to bring the rate down as we go into a spell of colder weather in the run up to Christmas. If we're going to be able to get rates down to anything which is acceptable, we need to act now and act early.
Professor Openshaw, thank you very much indeed.